I think the biggest thing is people just want to know that people care and that they're there for them.
Somehow, at one point, the tooth, like part of the tooth just flew out and almost took me out.
If you're struggling as a veterinarian and having trouble and you're in a dark place, then there's it's called Vets for Vets, and then the number 4 Vets. And you can reach out to them and they will have one-on-one conversations with you. There are other veterinarians that are trained in mental health and suicide prevention and things like that. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Where do people listen to podcasts besides Apple and Spotify?
YouTube, you guys.
Rumble. I don't know. Is Rumble
really
one?
Is there other actual platforms? I don't know.
Rumble? Isn't that one?
I don't know.
I don't listen to podcasts
Rumble.
other than ours. Does
Rumble.
Audible have Audible?
Audible?
That's just
Probably.
books.
Audible is just books, isn't it? Okay.
Anyway, sorry. That was just... No, it's a good question. Okay. But I have no feedback. Hammer us home, Devin. Okay. Hammering home. Reviews this week. Let's see. We are at 267 on Spotify. Previously, we were at 265. So that's 2. Same thing with Apple Podcasts. We were previously at 109. Now we're at 111.
Wow.
That's crazy, though.
And we delivered on one of the videos.
Yes, that's what. Yeah, we went out in public and
risked
stood
our
on the side
lives.
of the road.
Yep.
And held up signs and looked like fools and got honked at.
Yep.
But it was really
It was
fun.
so fun.
It was so much fun.
That was some of the most fun I've ever It had. made us feel really appreciated.
Now, did we put the video out, right?
We
Yeah,
sure did.
So everybody got to see how much fun and joy.
Those were
we
sincere
had a lot
reactions.
of people honking.
Yeah.
Yeah, like that one streak we had where it was like 7
like
in a row. It was like
just
honk,
boom, boom.
honk.
Yeah.
And everybody's honks were different. It was like sometimes it was like honk, and then sometimes it was like honk as they drove.
We got a few semis too.
Yeah,
We did,
Semis.
yes.
Those are really exciting.
I kind of
Yeah.
wish, thinking back, we had like a number we needed to meet, like 100 honks for 100.
Oh my
whatever.
Oh,
And
that
then I
would have been
wonder
good,
how
Duck
long
We
it
could
Ball.
have gotten there.
Yeah, like how long it would have taken.
We did guess at the beginning, and I was the closest.
Because we got way more honks than we thought.
Yeah,
we
we
were
would have
Yeah.
easily
Yeah.
gotten my number. I guessed 63, and these fools guessed like 10.
Yeah.
Yeah, I guess like 7. I
Yeah, it
forget
was
how many
pretty
we
cool.
ended up
People
getting.
were
At
really
20
into it.
20s, yeah.
We ended after 20
But
something.
we did it for literally 10 minutes.
Yeah. It was hard work.
People were really into it. I was
Yeah.
really surprised how many people had fun with it. They just
Yeah.
totally loved
Yeah.
it. It was great.
It was so
and then we
fun.
had people honking going the other direction.
Right.
Yes.
That weren't seeing, like, it was hilarious.
You were going crazy. You were
Yeah.
like running down like
Yeah, it was fun. It was a lot of fun.
Instant gratification.
It was instant
It
gratification.
made us feel good.
Yep.
So-
Thanks for all the honkers.
And thanks for the reviews
honkers.
so
And
that we
thanks for
could
the
do the
100
videos.
That's right.
Absolutely.
200 on our way.
Mm-hmm.
Now we got the pie video coming.
yes.
Did you guys schedule it?
Are we securing that date?
I don't know yet. Not sure.
Okay, well, we'll let you know the date once we decide.
We've got 2 more weeks. We got to get like 2 to 3 weeks out,
We got
and
a couple
then
things.
we're going to. Are you saying it?
Purdue.
Yeah. Okay.
Purdue.
You
so,
are?
Purdue students,
Yep.
get ready.
Get ready.
Better
Purdue
bundle up.
Veterinary
It's going to
School.
be cold up
I
there.
know. It's going to be chilly. And then I'm going to pie on my face.
Yeah, it's
It's going to be a great time.
Mm-hmm.
It's
That'll
gonna
be
be.
so fun.
It's gonna be.
But we'll let
very
you know
fun.
the date and time and where to find us when
Be prepared.
we get those details.
Yeah,
That's
that's
gonna
gonna
be.
be. that's
Come
gonna
with
be
your
hilarious.
cans
good
of
time.
whipped cream.
Do we get to know the questions before you go?
Yeah, I'll probably need like opinions,
Can you
ideas.
FaceTime us?
Yeah.
So we feel like we're
Yeah.
part of it. I'm
We
going to have
could
FOMO.
totally do that.
Yeah. Okay, new review. I have loved your show since your start with 5 Boys in a Business. You guys are some of the smartest people I know in the veterinary field. I have always looked up to you guys as role models, and I'm happy to say that I have loved the opportunity you gave me to be an intern for you all. I have learned so much. I highly recommend this clinic for anyone needing an internship or externship. Great people who know their stuff. Dr. King was a great boss and was always willing to teach anyone. You will see a lot of cases that I never thought I would see in real life. I love seeing their business succeed. I hope you all are doing well and wish you nothing but the best. At Molly Francis.
Thanks, Molly. That was very
Thank you.
kind.
Sweet.
We appreciate
Nice
that.
words. Gives us
Absolutely.
Been
motivation.
with us since the beginning.
Yeah, yeah, yeah.
Oh, I see here. I jumped the gun. I see.
Hey, it's all good.
On
It's
the
all right.
honking.
I mean,
That's okay.
But
We
we did do. We have
yes.
other stuff.
Yes.
We do.
Take it away.
Enlighten them. Oh. check out our most recent episode with Dr. Jordan Whitley. We discussed chiropractics. And then we have a few other guest episodes. If you haven't checked them out, check them out. We talked about nutrition with Dr. Danielle Conway, dog training with Gia Savachi, and what vet med is like in Mexico with Isabel Guzman.
And more.
There are many more
Yeah.
to be filmed and released.
Yeah, and there'll be more to come.
Yeah.
So
We've got lots good plans.
If you have anyone
Yeah, I
you'd
was
like
gonna
us
say.
to talk to, let us know.
Or
well,
any
and here's the thing. I
topics.
think we all have kind of thought about this and decided that like the forum, like the Vert, is really here to bring information to people.
Yes.
Not necessarily offer an opinion, although we do sometimes,
We'll
but
talk
really
about
just
it.
to get information out to people.
Yeah.
Out there.
We will have
Yeah.
those crucial
We will
conversations.
have those crucial conversations. That's right.
Yeah,
Exactly.
those are our favorite.
Mhm.
Absolutely.
Big fans, big fans.
You can find little tidbits of these episodes on our social media, Instagram and TikTok at the Veterinary Roundtable.
That was a beautiful segue.
That was
That
very
was.
good.
Thanks.
High five.
Wow.
I'm Dr. Emily King.
You skipped something.
We did?
Our other social media, YouTube channel.
We really gotta
That's
get
where you
better
can
at
find the
this.
full episodes. Going forward, they will be published at the Veterinary Roundtable's account versus
On the YouTube.
On YouTube.
YouTube.
I've
Yeah.
noticed
Yeah.
Harrison's
I
done
did
a
that.
little bit
Yeah, I
of
know, I was just
sprucing up
reiterating.
the picture for the podcast on
Nice.
YouTube. The thumbnail is what it's called.
Ooh,
What-
that
wait, what
sounds
is the
very
thumbnail? I haven't looked at it.
knowledgeable.
The thumbnails are good.
Yeah,
What's the
right.
thumbnail?
That's because
Like
Yeah,
the
the
thumbnails are
pictures.
like
No,
the
I know, but like, what is the picture?
Well, no,
I haven't
thumbnails,
looked at it.
they're different for every video.
Yeah.
Oh,
Like there's pictures of us in it.
I see.
Yeah.
I
Is that
thought
just
you
random
meant for like
and I
the
think
account.
Harrison, or is
I
it
don't know how it
Sean that's doing the
works.
thumbnails? Is that a thumbs up?
He's
He
getting
doesn't
his
have his
mic.
microphone ready.
Correct. Yes, it is Sean.
Okay, so
Nice
shout
job,
out to
Sean.
Sean because
Way to go, Sean.
we love the thumbnails.
They look fantastic.
The changes are noticed and approved.
Okay.
Mhm.
Wow.
Boop, boop.
Okay,
Modernizing.
now,
Okay, now I'm Dr. Emily King.
I'm Courtney Allen.
I'm Devin Fortune.
I'm Dr. Ashlyn Duckwall.
And this is the Veterinary Roundtable.
Welcome.
Welcome.
Welcome back. Welcome for the first time.
No, Pits and Peaks, my favorite.
Wow.
I'm
Jumped
lacking
right-
this week.
Jumped right in there. Okay, you're going first then,
I have
obviously.
food in my mouth.
You have
What
food
were
in
we
your
supposed
mouth.
to talk about?
What?
You
Pits
said
and
that she
Peaks?
jumped right in.
Oh, no, because it was like just boom, intro
I mean,
into
we're ready
Pits
to
and
go, man.
Peaks.
It's a Monday evening after work.
We're chop
ready.
chopping.
Hungry, tired, fatigued, everything in between.
Yep. We have no.
After a restful weekend.
Somebody put that on a t-shirt.
Yes. Okay, so Pits and Peaks, who's going?
You.
Okay, my pit. I diagnosed my sister's cat with renal failure and it's only 2 years old.
Oh.
I hate kidneys.
Yeah,
What?
I can't stand
Yeah.
Does
kidneys.
it have 2 kidneys?
I think so.
Did you ultrasound it?
I mean, that's a valid
That was
question.
just a funny question.
She
I don't know why.
loves looking for a second kidney.
Yes,
That's
no,
what-
I did not because we are like
And there should be
they're so bad. The values are so bad.
Oh.
So like we're
Is it
just like
lepto?
supportive care.
What do we think caused
Did you
it?
test for lepto?
Well, it was a cat, so I didn't do it.
Did it go outside?
Didn't do any of that. So like because it's so bad.
Lymphoma?
Oh,
Okay.
I'm done.
So we did supportive care just to give her time to wrap her brain around the fact that
That's wild.
It's not
Do you have
good.
any idea like what caused? Such
I mean it is an indoor outdoor cat. She's only
does
2.
it drink standing still water?
So I mean it's possible.
Not funny.
But I mean it's possible. And she has like a phosphorus greater than 16 and like
Oh.
I mean it's just not good.
I bet there's
Dang.
1 kidney.
There could be. But we couldn't pursue any additional. But it's always hard when you have your 5 nephews and nieces staring at you.
How did you just go to their house and drop?
No,
blood?
they
Like-
came into the clinic.
Oh, okay.
Yeah. And so
Interesting.
then we drew
That's
blood
real.
and
Yes, sir.
diagnosed it. And now we're just doing conservative therapy and
Who is it?
Courtney's cat, Flair.
I don't know
I
if I've
hate
met
kidney
Flair.
disease.
Yeah.
I like
it's
that
just
name.
Flair. Yeah.
Is it FLARE or IR?
IR. Yeah.
I had to think about that.
So, that's a bummer.
Yeah, that
But,
stinks.
I know.
I'm sorry.
It does.
That's really unlucky.
It really is. So I don't know if she got into something or
Yeah, that's
some
just
kind of,
crappy
antifreeze.
genetics.
or maybe she was born
Just like them
you were mentioning,
lilies.
with 1 kidney or had renal dysplasia or I mean, there could be-
Antifreeze will get you.
There's a lot of things.
It's crazy how like different lifespans cats can have, or animals in general. But like some
Yeah.
live 2 years and some live 22.
Yep.
Okay, what's your peak?
My peak. Do I have a peak this week?
I was gonna.
Well, I was saving that for next week, but okay. So,
I was gonna say it for you.
Okay, that's everybody's peak, right?
Yeah.
We are expecting 2 grandbabies.
Yay!
On Wednesday
At
morning.
the same time.
At the same time.
Not
That's
from two
right.
separate people, one person, one mom.
It's called twins nowadays.
Harrison's baby boys are going to be born on Wednesday morning at 7:15 a.m. And we're very excited.
Wait, you go in at 7:15 or like
5:15.
That's
Okay,
crazy.
yeah.
Holy
Yeah,
crap.
So
get that
surgery-
going.
Yep, right?
That's right.
Yep.
That way she doesn't have to fast too long.
Yep.
That's a real downer.
She's not going to sleep tomorrow night. So, like,
no.
then you can just go in and
Yeah.
then sleep
Have
afterwards.
those bebes.
Wow,
Yeah.
wow, wow,
Gosh,
wow.
that's
We
so
are
exciting.
so excited.
We are very excited.
2 boys. So, we're super excited. So,
Lots of boys in the family.
Lots of boys. Just
Boy
adding
genes
to
are
the
strong.
fraternity. Yeah.
Oh my
Exactly.
goodness.
The fraternity.
So, okay. So, that's my stuff.
Okay, sure.
Yeah.
My peak, I'll start with my peak, is it's my husband and I's 1-year wedding anniversary tomorrow.
Oh, that's nice.
Yeah, I
Fun.
know. It's exciting. He works from home and I have the day off, so we get to like technically be together. But we're not celebrating till Saturday because I don't like going out on work nights because I'm an old lady. Like I want to be able to just like not
I
have to
hear
worry
that.
about getting home
Yeah.
at a certain time because I have a bedtime, you know.
Yep.
So we're gonna celebrate this Saturday, but I'm really excited. And then my pit is kind of stupid, but the Cleveland Browns suck.
Yes. Oh my God, bless your heart.
Like it is like it's
It is
always
bad now.
it's always been a running joke. Oh my God, you're a Browns fan, but like it's getting really hard to be a Browns fan. Like it's really, really hard.
Rough.
It's bad.
Are you gonna leave?
Are you leaving?
No, you
Yeah.
can't.
You
can't
can't
be-
bought a
it's
different
it's not what-
That'd be
bandwagon.
pretty fake.
You can't do that. You can't.
Right, because
I have to-
eventually
I'm a
it
Browns
may
fan.
turn around.
Yeah.
I know it may
Yeah.
turn around. It's just
I mean, last year was pretty promising. I mean, I know Flacco was old and all that, but I mean, it was
that was a stupid decision we ever made. Was
But-
getting rid of Joe Flacco. But I could go on and on about that. It just really sucks
I just stay out.
yeah.
rooting for a not so great football. It's just disappointing.
I get it. Yeah.
We are literally like the worst team in the league right now. We have the highest
Well,
sack
there's only
quarterback.
up from here.
That's right.
Not in Cleveland.
Not in Cleveland.
So that's just my pit. It's just getting hard to watch,
Yeah.
but it's okay.
That's fair.
That's all I got.
I actually don't know if I have a pit this week.
That's good.
That's a good thing.
Well, that's a good week.
You have an upcoming pit.
It's my upcoming pit.
I don't know if you have something you're not looking forward
so
to.
what do you know that I don't?
Yeah.
I guess for my peak, something really wholesome, I thought. So my niece and nephew, they're twins. They are like math 13 months old, so freshly a year old, and they both just started to walk a week ago. And my brother told me that, well, I asked like if they're talking or whatever because I don't know the baby milestones, and he said that they're like babbling, but the boy can say one word. Anyone want to guess what that one word is?
Walter.
No. Kind of close, but it's their dog's name. It's Gunner. It's like the only word he can say. He goes, Under.
Oh, that's so
And
cute.
And they're
That's
best
so
friends.
cute.
It's so cute.
Aw.
Whenever I'm over there, he's just like, they're in love. The dog and Weston. They just
That's
are
so
obsessed with each other.
That's awesome.
And the
That's
only word he can
adorable.
say is Unner.
It's so innocent.
He can say "ga" and "unner," but he can't combine the
Yeah.
two.
Yeah, that's hard. That's hard.
So I thought it was cute.
That's
Baby
very cute.
babbling is the best. They're just
Yeah.
like, okay.
I think it's so
But you have
funny
a full
watching
conversation with them.
owners or not owners.
I say that too.
Parents, like sometimes a baby says something and I'm like, how did you understand that?
Yeah, you just guess
You learn that
until you
language.
get it right.
Yep.
I kept calling when Helen was born. I still want to say it. Her name card on her bassinet, I kept calling it a cage card.
A cage card.
And I kept, Charles
That's
was like,
amazing.
It's not a cage card. I just kept saying it. It was,
I think that's funny.
yeah, the nurse had
That's
no idea.
amazing. I love it. A cage guard. That's terrific.
It's her run.
You're
Anyway.
like, but it is.
But
Okay.
it's kind of is.
It's funny.
My pit, but also a peak, is I started to get the clinic sickness this weekend. I felt it on Friday, and you just know I'm very in tuned. I know when I'm
Mhm.
getting there because my colds turn into like basically hacking pneumonia quickly.
Literally walking.
I'm
pneumonia.
laughing, but it's so true.
Yeah.
Did you start
Anyway.
your Zycam?
Yes.
Okay.
I
Good
did
one, good job.
Zycam, and I hate Zycam. I want to gag and throw up every time I have to take it because of the texture. But lemon lime is not that bad.
What's Zycam?
It's a zinc
Yeah.
supplement
it's like
that's
a tablet,
supposed
but
to
it has
help
to
like,
dissolve in your mouth.
and it's supposed to
didn't know if it
help
was for
like
your
decrease
asthma.
the duration
Great
and the
question.
symptoms of your illness.
And
Respiratory
legitimately, I did it. I didn't do it every 2 to 3 hours, but I did it as like 3 or 4 times a day. I feel great.
Look at you.
I'm so happy. I would have been like, so,
Well, good.
but so that was a peak. And also, we added another 4-legged friend to the farm, and it is Devon's pony.
Yes, it's very exciting.
She grew up with Jazz.
I did. We got him when
And,
I was 6.
Yeah.
And
He's 22 now.
yeah,
And
I'm 21.
it was just kind of like a blessing. Like, I really needed a buddy, but like nothing crazy. I didn't
Yeah.
really need to go out and get something fancy. And it just was perfect timing for her family. And
So we've had him, and it's a long story, but we've had him and we don't really do anything with him.
Yeah.
And I was like, Duckwall, I have a pony. If you want him, now is your chance.
yeah.
So it did work out really well. And now Helen gets to grow up with
And
him.
and brush him
Yes.
and walk him.
That's
and,
so cute.
Mhm.
and
So
it's
that was
so
yesterday.
awesome how, because I have a 6-year-old horse who's kind of like just dumb and crazy right now. And Jazz just legit didn't give 2 craps. Went up, looked at him, walked away, just not bothered. And the other one's like running.
Arthur's
and,
so excited.
Yeah.
Oh my gosh.
It was
like,
yeah,
I can't wait to watch
literally.
them together.
Yeah.
Oh, that's
I'm
so
glad it worked
funny.
out.
Me too.
And now I know he's he was in a great home, but I know
Yes.
he's still in a great home.
Oh,
and
yeah.
I'm going to see him all the time.
Yep.
And
Yep.
Yeah, that's exciting.
That's very cool.
go there for a Christmas party, and boom, there's my horse.
Oh, yeah. Think about it. Good stuff.
Good
Mhm.
stuff.
Okay.
Okay. Trending veterinary topics.
Let's do it. We love this section.
First one.
Break. Okay.
Go ahead.
Go right. Okay. Breakthrough in periodontal disease treatment gel. Who wants to summarize the article?
King-a-ling-a-ding-ding
She
has
has
the
it printed
start of
out,
the
so
article.
we'll-
Well, I have a printout of it. It's really cool.
Go right ahead.
It's called Oral BioLife. It's that's the company that developed this kind of treatment. But basically, it is a product that is proven to be effective in promoting the regeneration of bone and furcations of teeth.
Oh.
Right?
Interesting.
Yeah.
So,
It was tested.
But it tested on
I'm
three
It was
sorry, I
beagles.
should have
was-
known this.
It was tested in 3 beagles.
right.
3 dogs though only.
Okay,
And they were
well,
all beagles.
still though, I mean, if they're
can run.
seeing a change in all
Right.
3 dogs,
Right.
but I mean, furcations are basically a loss of bone
Mhm.
Mm-hmm.
around the tooth roots, and so then you can see through. I don't know how to explain this, so people can like.
It's like
visualize
this, and you can see through it.
Yeah.
Is it like a cavity
no,
ish?
no,
No.
it's a loss of bone. Where's Carla Cloud when we need her?
Well, I know what it is. I
Okay,
just
so
didn't know how to
bone gets
equate it.
lost,
Yeah.
right? And then
Yeah, it's like-
his roots are still here, and so now you can the roots are
It's
exposed.
it's a cave between the roots.
yes.
That's what I.
Okay. Yep. You cave between the roots. Okay.
And it can be
yes.
painful. It can expose them to tooth root abscesses.
Infection.
Yes.
Mhm.
And so this company has used biotechnology to create basically an approach to treating periodontal disease in these patients. And so then it is basically a way of promoting bone growth.
Mm-hmm.
So it's pretty cool.
It'll be
So
interesting to see how
he
it
says
develops.
one of the points in the article is that 80 to 90% over the age of 2 have some component of periodontal disease. This is in dogs. These numbers are even worse in smaller dogs.
Yep.
Yes, they are.
Bingo.
They're going to show signs of pain by rubbing, pawing at their mouth, drooling, decreased appetite, sometimes just odor. Yep,
Ugh.
in their mouths.
Ugh.
And then let's see here. So they're trying to develop non-invasive ways for dental care. And so, yeah, it's pretty cool. It's pretty
Mhm.
interesting.
That is so interesting because
So they had
it's
3
like,
dogs, 3 and 3, basically,
Mhm.
right? So they had 3 in a control and then 3
Does
doing
it say
the-
how often they have to apply it?
I
in
didn't
the
see
study,
that in there,
radiographs were taken at baseline, 28 days following the first application of the product and 29 days after the second application. So 2.
Okay, that's different than what I was imagining. So that's cool.
Mhm. So then they took x-rays and they were all 3 of the dogs that were treated with the product showed an increase in bone regeneration at both the first and second months post treatments.
Is it available to like the general public?
I don't know. It doesn't really say that yet.
Yeah,
they're
probably
going to
still working
continue
on
their
it.
research. Basically, they're continuing their research.
okay.
They're just making people aware of it, and
Yeah.
it's kind of cool.
Nice.
It is.
Today I discovered that I already had a feeling, but I cannot do teeth. Like,
Oh, interesting. Like you don't like the
I have really sensitive teeth, but today, like, Ham was removing a tooth on a dog, and I was like standing there a little questionable. Somehow at one point the tooth, like part of the tooth just flew out and almost took me out. But then a little bit later, like it just made a noise and I had to walk away.
yeah.
Like I was about
a
to
crack.
vomit. It makes my teeth hurt and they're like in there and I just can't.
We all have that one thing.
Some people
Yeah.
have like
It
eyeballs they
makes me
can't do.
hurt.
Some people
I
have
don't like bugs.
I thought I was gonna be
Tapeworms, like meaning like worms.
Yeah.
yeah.
Oh.
I thought I was gonna be tough and like nothing would bother me like that, but mouth definitely does.
That was
especially when
fascinating.
they're like breaking the tooth off and like
Mm.
putting, I don't know what the tools are called, but like trying to
The
pop it out of the
elevators.
gum. Yeah.
Figure out some
Oh.
elevators.
Yeah.
Oh my
I
god.
just want to point out that you guys were talking about surgical things like eyeballs and teeth, and then Duckball said that she doesn't like worms.
Have you ever seen a live worm come out of a butthole,
It's pretty
Harrison?
gross.
When you least expect it.
Oh my
it's
god, that's
moving.
hilarious. Oh,
Yeah.
geez.
We all have that one thing.
What's your thing? Do you have a thing?
Really? Like, I mean, I feel like it's kind of basic, like nasty ears. Like a lot of, I
That
can
smell
handle
that you
a
The
can
lot.
knock
ears
it
that
out.
will stink up a house.
Oh.
Yes, that or just like the mouth, like really, really bad, like 4 out of 4, like dental disease. I just, when it, like when I'm drawing blood on a dog and it's a very old dog with really
You
bad
see
teeth,
that?
Yeah.
if I see it or if they breathe in my face while I'm drawing blood, I have to tap out.
Yeah.
Oh my God, it's horrible.
I really want to see an enucleation. I haven't seen much with the eyeballs.
I like
so
cutting
wonder how
eyeballs
I'd do.
open. Sorry.
It's just
Yeah.
Today for Tech Week, there were a bunch of techs standing in a hallway chit chatting, and we had just done a neuter, so I took a testicle and threw it down the aisle, and they're all like, "Wait." It was really funny.
Speaking of, that should be one of our peaks. Veterinary Technician
Yeah.
Appreciation Week.
That
is a good peak.
Tech appreciation.
Yeah, that's pretty cool.
Confetti.
Woo!
Pew, pew, pew.
Okay, I just wanted to say that. No,
Yeah,
that's
I was
great.
also disappointed because I've been told that if you throw it at a window, it'll stick. It did not.
It just rolled down.
There was
or just
blood
bounced?
splatter all over the wall, and it did not stick.
The DVM at my school would, because we had a viewing window in our surgery suite, kind of like the ones at the clinic,
Yeah.
and she would throw uteruses and testicles at the window if
Mhm.
there was a lot of students standing
Yeah, it
there.
didn't stick at
And
all.
she would throw the uteruses, and then guess who would clean it up? Us.
Yeah, I'm not
So much
sure if
blood.
throwing body parts is
Well, no,
advised.
advised.
it's not.
or promoted.
No, no, definitely not.
Gosh.
What was that one? Oh, when we had that kitten with the tail that we cut off.
Hey.
We were
that's-
walking around trying to. Oh,
Oh, I thought you were gonna shut up.
wait, it's
I thought you were gonna say
today.
What?
No.
No, continue.
Okay, let's
Carry
go on. Let's not.
Oh no. Anyway,
Okay, that's a whole different episode. Inappropriate,
Inappropriate things you can do in vet
inappropriate
med.
things
That
in
stays
vet
between
med.
us.
Oh my goodness. Okay.
Hmm.
What? Ow.
All right, so changing tunes a little bit.
Oh.
The other veterinary topic. Our hearts go out to Texas A&M students and
Community.
community.
Just, yeah.
I mean, anyone
Family- or
affected from
family.
this directly and indirectly. They had a classmate commit suicide, which we will talk about later in this episode, but it is a topic that is hard
Yeah.
to discuss, but should be discussed. So
Mhm.
Yes.
we're thinking and praying for you guys.
Yes.
Mm-hmm.
So, okay.
Listener inquiries.
Well,
What is? Oh,
What is Dr. King?
I could wait. I was like, oh.
we just started at the same tone. Show us your muscle.
Yeah, get up there and flex.
Yeah, will you walk us through it?
Can we have a tutorial?
Okay, we
Okay.
should read it. We should read it.
What is
Oh,
Dr. King's
geez.
workout routine? How do you find time to work out and be healthy as a busy professional? From Anonymous.
Maybe
Is
don't
this
give
your
us-
trainer making this comment?
I know, right?
Was it you?
I sent my own question in.
Was it Richie?
Okay, my workout routine is, let's see,
Enlighten us.
I go to workout, which is like cross training.
Oh, yeah.
Like CrossFit?
No.
Oh.
But like it's just cross training. So it's like whole body work, like so you're doing weights and cardio and stuff like that. And I do that on Tuesday, Fridays, and Sundays. And then I walk or ride the Peloton on the other days. That's it.
That's how she gets that banging bond.
How long are your
Watch out, Richie. Someone's noticing.
That's right.
How long are your workouts at cross training?
An hour.
Not bad.
Not
How
bad,
long
right?
do you do the
Are they rough?
Peloton?
No, they're fantastic. I mean, they're great. They're like just hard
Yeah.
enough that you feel like you did something.
You're not like, I need to sit down.
No, it's not like that. Most of the time, it's not like that. Sometimes some of those ladders, like ladder workouts where you go up and back down, like, okay, we're going to do 20 kettlebell swings, 15 man makers, 10 B's, 10, and then
Yeah.
you guys,
you-
why are you
so
laughing?
you
You guys
work-
do nothing, do you?
No,
She has asthma. She can't handle much.
she has bad elbows.
I couldn't
She
catch
did
my
the
breath after a
elbows.
video.
Oh my gosh.
So you work out every single day of the week?
I usually take one day off, one or two, depending on the week. But walking isn't working out. I don't consider that really working
It's
out.
cardio. It's getting your
Yeah,
heart rate
yeah.
up.
Yeah.
It's
Yeah,
good
but
cardio.
I mean,
You're walking like Terry.
It's good for you.
Terry accidentally called the group meeting today, like at 6:15, and I was
Oh, I
helping
saw
Courtney
that.
finish up, so I answered just to see what would happen, and you could hear her walking so briskly with someone. It's like
She was moving.
oh my gosh, she might have been at Monday morning workout. There's
She
like a
was
6:15
moving.
workout.
no, it was this afternoon.
Oh, it was this
6:15
afternoon.
p.m. But she was
walking
moving.
fast. They were talking tea too, so I just hung up.
Yeah.
It was really funny.
So
Okay, so second question. How do you find the time?
Oh,
You make time.
yeah, I think somebody taught me a long time ago that you have non-negotiables, and so and if you make certain things your non-negotiables, then you'll never miss them. Because as soon as you give a reason that it's okay to miss it, then there's
It's easy.
always something to make you miss it. Like there will always be something.
Yeah.
So like you pre-decide that those are your non-negotiables.
Yep.
And then you build around those things.
love it.
Gotta get her done.
It's a priority.
And I think it's great. I think because it gives me an outlet for,
Yeah.
stress,
of things,
thinking,
yeah.
all kinds of stuff. I come up with some of my best ideas.
I believe it.
Wow.
I don't doubt that.
So anyway, okay.
All right. Hopefully that helps you.
Yeah.
All right, next one here. Let's go. I've been listening to back episodes and really enjoyed the conversation about ethically prescribing Simparica Trio. Our clinic recently switched from having Simparica Trio in-house to Nexguard Plus. What do y'all think of the Nexguard Plus? Do you carry it in your clinic? If not, why? Thanks. At MK O'Haver. I hope I said that right.
It does not cover as many ticks, correct?
Correct.
Many
So
I
it's
have the
amazing.
statistics.
Oh wow.
Oh.
Yes.
I printed it. The ticks that, just fact check here real quick. It covers, so Nexguard doesn't cover Gulf Coast ticks, but Trio does.
Mm-hmm.
Golf.
Yep.
Gulf.
Gulf Coast. Mm-hmm.
And then otherwise they cover all the same ticks.
Yeah, I mean, if you look at the two products side by side, they're both have moxidectin, both have Periodontal.
Mhm.
The only difference is the flea and tick agent, and that agent is of the isoxazoline family.
Yeah, I was gonna
Mhm.
ask.
So they're both using an agent of the isoxazoline
Yeah.
family.
Yeah.
It's typically our next choice if for some reason an owner doesn't want Simparica Trio.
Yeah. I mean, I kind of lay out the law of the land of all the options that they can just
Mhm.
choose from based
Mhm.
off what they're comfortable with, what they cover, what they don't, what they're missing out on, blah, blah, blah.
But we do
So-
not carry it in our clinic.
Correct.
We do not carry it in the clinic because we minimize the amount
Mhm.
of products that we carry. So we streamline inventory.
Yeah.
Mhm.
So I think a lot of clinics will carry like 6 different products, and then
Mhm.
but we don't do that, especially now with the invention of the online pharmacies that can run through your clinics. So you still have those options available to people.
Mhm.
It's just that you don't have to carry them on your shelf and then have the carrying costs associated with the products that
Mhm.
you don't dispense that frequently.
Yeah.
So we went with all Zoetis products so that then we have the support of Zoetis.
Sure.
So that's
If
been-
someone wants to do it, I'm not against it.
No,
Mhm.
I don't think.
No,
I mean,
I think we have it on the online pharmacy, don't
Yeah.
we?
Yeah.
yeah. Oh yeah.
We have a lot
I
on
mean, there really wouldn't be a reason to. I mean, the thought process was, one, we use Zoetis products. So if something happens to the patient, then Zoetis is the only company that can be responsible for it. There's no other product going in the pets.
Mhm.
And 2, if you're going to pay for something, get the thing that has the most coverage.
Yeah.
Right.
Is kind of how we ended up in that boat.
Mhm.
But I agree with you. I don't think I don't think it's wrong to use
Mm-mm.
Nexguard by any means.
And
Unless you
some-
live someplace where Gulf Coast ticks are prevalent, then
Mhm.
I would be like, why are you using Nexguard?
And some
products?
patients tolerate different products differently too.
Mhm.
So
Yeah.
I will also
It's not-
say, Trio's indicated for the prevention of Lyme disease, and there's no indication the uses of
Yeah.
Nexguard Plus against Lyme disease.
So so Zoetis will cover the pet.
Yeah.
They believe so heavily in the prevention of Lyme disease with their
Mhm.
product that if your pet gets Lyme disease while on their product, they will treat your pet.
Mm-hmm.
And it goes down to 2.8 pounds.
That's what I was gonna say. That was my
Yeah.
next point. Is that the minimum weight for Trio is 2.8. The minimum weight for Nexguard is 4 pounds. And Nexguard is beef flavor, and Simparica Trio's liver flavor.
There you
So
go.
Some might say liver's more
A good
enticing.
liver, good juiced liver.
Good piece
That's
of
like
liver.
those are literally the only
So
differences.
palatable.
Nice.
Okay.
Okay.
Next
There
question.
you go. Hope we answered that okay for you.
This is the good one. Okay. Hey guys, I'm Abby Hartz, and I'm currently an undergrad student at Purdue studying biology on the pre-vet track. Recently, in one of my classes, they told us to think about what we want to bring to the veterinary field when applying to vet school and think about what kind of veterinarian we want to be. I thought this was super thought-provoking, and maybe you guys could touch on what kind of things you strive for as a vet to make the provider you are. I love the podcast so much, and hopefully I can buy Devin and you guys come up to Purdue.
Oh,
From
Abby.
Abby Hartz.
Oh, Abby, just wait.
Oh, Abby.
You can
better
definitely.
do your studying, because I think this is the girl that I said I was gonna ask a hard question.
Yeah.
So
Go deep.
What
into
are
your
what are the
textbook.
parameters of the questions? Do we know yet?
I
Like,
feel
what are the
there should
lines,
be a
the
few
boundaries?
levels. I have a question that keeps coming to mind, but I
Do
can't
they move up in closeness if they answer? So like they answer the first one, you're at
Oh.
8 feet. Then you get to go 6 feet.
No,
then
then
you get to go
then
to
that
3
gives them
feet.
more chances to pie me.
Okay.
Yeah, that's a good point. Minimal chances for pie.
Minimal chances. Okay,
I
gotcha.
say, I don't know. We can work out the logistics.
details of
But
the
maybe
questions.
like 2 chances a person. Like they get the
Okay.
first question. I don't know. We'll work.
We'll
We'll
work
work
on
it
it.
out.
Depends how long the line is. You know what I'm saying?
Either way, do your studying.
Wrap it
Someone's
around
just
the
gonna-
building. We got to wrap it up here.
Someone's just gonna come with a spray can and be like, "Psst."
For real. Well, I hope to see you then.
Yes, that's
Abby.
really cool. Abby.
I'll
Yeah.
let you know. Great question.
That is an
Actually.
awesome question, actually.
Yeah.
What you want to bring to the
Appreciate
vet med table?
Yeah. I really appreciate like educating owners on like why we're doing things for their pet, what it means. I feel like that helps them understand and be more compliant. So I'm all about educating and them knowing the why.
Yeah.
Mm-hmm.
Because I feel like a lot of times we're just like saying all this mumbo jumbo and they're like, okay, but they don't really understand. So.
Yeah, absolutely.
Yeah.
I don't know if really what I'm gonna say is like pertaining to. I think this is what I wish like would happen better in like especially tech school, is that they prepared you better. Like I would like if I could do one like. I've thought about it, but like if I could do something, it would be going around to all of these tech schools and like truly preparing these people for what they're about to get themselves into. Not to deter them from the field by any means, but to just like give them a taste of real life. Because if you don't, I mean, Devin and I preach it all the time, externships and internships and shadowing and whatnot. But just really like if you don't do that before or after school or before school, during school, whatever, and you just go into the field without ever working at a clinic, I feel like you're thrown to the wolves. Which I feel like maybe that's true for a lot of fields, but I want to like just prepare people, like truly prepare, like the mental aspect, the physical aspect, all of it.
Do you feel like that makes you the provider that you are today? Like having that as your.
Yes.
Yeah.
Mm-hmm.
No, I was just curious.
Because I just don't think people like you just really don't know what you're getting into until you're in it.
Yeah.
Yeah.
So I just think it'd be helpful to really prepare people.
Yeah.
Because maybe they would be better educated and better prepared for like not to prevent burnout and have tools that they need prior to just being in it. Like when it's too
So
far
just trying
gone.
to make it better
Yeah.
for
Mhm.
people
Yeah.
coming behind you.
Transitioning period.
Yeah.
And I would also like mental health to be more just
Yeah.
better recognized.
Yeah.
We should have like mandated therapy sessions once a month or something.
Yeah. I mean,
If you need it. Yeah.
But you never
I don't know if I
Yeah,
really
need it or
answered the
not.
question properly, but
No, I think
it's
you
good.
did.
Everyone
That's
has
what
to
makes
make
it
it
better
happen
than
in
where you
vet
left
med.
it.
Yeah.
Yeah.
Do you see yourself like becoming some sort of advisor and
Maybe.
going around and doing that?
yeah, because I don't know if I can do this for the rest of my life.
Yeah.
Just because
You'd be walking into a class and sit your ass down. This is how it goes.
Yeah, I've thought of. I mean, yeah, maybe. Catch me giving lectures.
Teacher Courtney. Mystery.
And I
Prof
sign up for
Courtney.
online
Put
course.
your phones away.
That's right. Oh gosh.
What kind of things I strive for to make me the provider? A big thing I try to exude is my like compassion for each situation, which I think is a big motivator for being the provider I try to be, because even if there are owners who are upset or angry or don't trust me, I try the best. I strive to show them like I'm making these decisions because I thoughtfully and meticulously thought about your pet because I care about their well-being.
Mm-hmm.
Now, whether or not they think I'm just putting on a front, that's on them, not on me. But yeah, I think that's a huge thing to show people that for me. I just want you to know, like, I am passionate about it and I do wish the best for you guys.
Yeah.
Mm-hmm.
I will do my best to get you there. I can't always fix it, but
Yes, I would say you do a great job of that.
thanks.
Yeah.
Dr. Duckworth.
Yeah. People call me Duckworth all the time.
All the
that's
time.
fine.
Even today.
I would think so. I mean, I don't know why that rolls off the tongue better. Like,
I
you
don't
know what I
either.
mean?
It always does.
fine.
It's like, yeah, I don't get it.
We can change my names.
Is there somebody famous named Duckworth or something?
Nope.
I don't think so.
I don't think it's any easier than Duckwall.
I don't know.
And clients will repeatedly do it, even though I'm like, Dr. Duckwall. They're like, yeah, Duckworth.
I think
Yeah, that one.
Cindy said it the other day.
Yeah.
She knows you.
Right. Right.
Please, she sees you like once a week.
It's like, I correct that. And then,
Literally.
I know it doesn't bother you, but every time they're like, oh, yeah, did you tell Emily? I'm like, Dr. King.
Yeah,
Respect the
I'm
name.
sorry.
Yeah, it was funny. One time, like, kind of back when I started, but we had the painting crew come in. Like, we're looking for Emily. And I had to turn around and be like, who's Emily?
Oh gosh.
Who's Emily? Emily doesn't work here.
Oh, that's funny. I think the thing, to piggyback off of what Duckworth said, I think that I wanted to be the person who could get the problem solved. Like we may not know, like when I'm in a room, I may not know the answer, but I will find the answer.
Mm-hmm.
Like
Yes,
there's
ma'am.
no, like we will find the answer, and hardly ever would you have to go someplace else to find the answer.
Mm.
And so just being willing to put the work in to find the answer,
Yeah.
And be committed to problem solving and not settling for, guessing or,
Sure.
most of the time, you know what I mean? Like really being committed to that, which I think builds relationships.
Yep.
Mm-hmm.
So then you get that trust and all of that. And I think taking the time to get to know people so that they, are willing to act when you ask them to act.
Mhm.
Mm-hmm.
And so taking a minute to ask them about their family life or whatever's going on with them in the
Yeah.
exam room.
I originally thought in corny in my head, a corny thing in my head,
No.
but I was like, to be a part of their family. Like
Yeah.
that's what
Yeah.
kind of
You're
striving for. is
Absolutely.
maybe like a distant relative.
Right.
So like I don't get a phone call all the time.
Right.
But like
Exactly.
Mhm.
Exactly. So
Yeah.
anyway,
A friend.
that's a great question.
Yeah. Awesome. Okay. Thank you all so much for our inquiries. Remember, if you have an inquiry to suggest, use our little text message feature.
Mhm.
What? Do you want to? Am I stealing your thunder? Nope. Oh, right.
Stepping on some
I've
toes.
actually- Go
No,
right
go-
ahead. Okay. Text message feature for our podcast. I might put this on your podcast provider. Tap on the episode and at the top where it says send us an inquiry through a text message here. Tap that and shoot us a message. Be sure to include your name if you want recognition.
tap, tap, tap.
Tap tap.
Yeah, that sounds good.
Okay.
Okay,
That
now
just
let's hear.
reminded me today. I had a kitten. Sorry, I'm changing gears.
Okay.
And I was petting the kitten, and it was a Savannah kitten, super cute. Yes, spicy
She
kitten.
was spicy.
But the mom was like, oh my gosh, she was hissing, like
Mom was hissing.
What am I trying to say? She's trying to reenact the kitten's hiss when something happened, but she did it so realistic. The kitten was like, "Oh shit!" Like the cat looked back and I was petting it. I was like, that wasn't me. I'm not hissing at you.
That's
Anyway,
hilarious.
That kitten is going to be rotten.
Yep.
Oh, goodness.
I just had to do nail trim on her and I got one pot on. Like, yeah, we're done.
Yeah.
And I was like, she's gonna need some meds in the future.
Get her a prescription for gabapentin.
she's a spunky little thing though.
Yeah,
She was
she's
carrying
nice.
the little toy mouse around like she was a predator.
Yep.
The
she was-
expensive breeds, man. They're
Dude,
always got something.
she's predator.
Yep. Oh boy.
Now let's hear a word from our sponsor.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
You go?
I'll go. Okay. So we had an Australian Shepherd come in for his annual. He's older, maybe like 8 to 10, I think, somewhere in that age range. I can't remember. We just came in for his annual. The owner really didn't have any concerns, necessarily like any major concerns. Maybe
Wait,
just
this might be the one I was gonna do. Keep going.
LOL.
Same brain. Same brain, same team. Keep going.
Just like you guys work together.
Is it Jackson?
Okay, well, we're down
Okay,
to
you
two
guys
cases.
Well, she can get for her doctor side of it.
Okay. I like it.
So he came in really no
Coke
concerns.
Did you just drip Coke down yourself?
Coke in the lung.
We just went down the wrong pipe.
Oh God, she's gonna get aspiration pneumonia.
This is why she's not allowed to drink on the podcast.
Okay, keep
Okay,
going.
anyway. Mind you, she's drinking a Coke, not an alcoholic beverage. Okay, so he comes in for an annual. No major concerns, just aging, whatever. He does have to come to the back for exam just because of temperament, and Dad knows that. So he comes back, I get a muzzle on him, and then she starts doing her exam, but I was like, oh my God. Like I touched something on his ear and it felt kind of gross. It was kind of like moist. And I was like, oh, he has a mat on his ear. And then we started smelling something.
Uh-oh.
It was a
We
horrible.
saw pus.
We saw pus. We started smelling infection, and we're like, "Oh my God!" And then we kind of briefly looked at it, and we're like, "Okay, this needs to be cleaned. Like
Yeah.
this is bad." And so she did the majority of the rest of her exam, and then our room assistant came back, and we were like, "Did he mention anything about the ear?" And she was like, oh, yeah, he said he kind of grooms him at home. He cuts mats out of his ears. And he said he may have nicked him, but it was nothing crazy. And so
Yeah.
the owner's like, yeah, the dog's not bothered by it. He didn't care when I nicked him. He barely even reacted. And we're like, okay. And so we're like, well, this is pretty infected by what we can see. I mean, we could see a very small amount. And so we injectively sedated him in order to safely clip the area and whatnot, because that's already a sensitive spot. Well, Duckwell went to talk to the owner and everything, and I started clipping it, or she went to do something. And oh my God, it was like a mat, like yay big, probably. And it was just pus and infection and matted hair and blood. And there was a literal flap of skin, but it was a thick flap of skin because it had been there for a few days. So the granulation tissue had started.
Yeah.
And the owner cut a chunk of skin off of this dog, and it was just flapping in the wind.
We picked up
the whole
crust
triangle
or whatever
like
for
the
a
triangle
second.
piece of- yeah.
Yes, the triangle piece of flap or skin. I picked it up when I saw like sub-Q deeper tissue. I was like, we're gonna have to fix this.
But like
did you?
We clipped it or we cleaned it, and then
the skin off.
Yes. So we clipped her on the whole thing, and then we cut that little flapper off. But like it was just the owner was so not like he wasn't even gonna mention
That's a good Australian Shepherd.
Oh no, we had to inject a little.
No, I know, but the fact that he didn't bite the dad when he did that.
Well, no, the owner did say, he's like, yeah, when I was clipping the mats out, he went,
Jesus, because you
don't
cut off his
say.
ear. Oh yeah, it's a nice
see
little
it.
chunk. Yeah.
yeah, that it was gonna heal ugly if I
Ugly.
left it, and so
He would have had a nubbin.
yep.
But like it was just he literally had a nub on his ear.
So yeah, it was behind the ear on the base.
Yeah.
It wasn't like the ear itself, but it was still
There's a lot of
like-
skin there.
Yeah, no.
Don't use scissors.
That we see
Just,
that all the
like,
time.
be
Don't
careful.
use scissors because you pull on the mat, which tense the skin up, and then you cut the skin.
Snips into the skin. That's
And we
exactly
see it
what
all
he
the
did.
time when
Yeah.
people use scissors. Don't use
Oh
scissors.
yeah, we see it all the time.
Just get safe clippers.
No
and go
Edward
slow.
Scissorhands.
Yeah. Here, cut off an ear. Yeah,
But
that
yeah.
was my case also.
I'm sorry.
Oh no, I think it's hilarious. We didn't
Yeah.
even talk about it, but it cleaned up nicely. I mean, they did
Tell
some
people why you chose to cut the flap of skin off instead of reoppose it.
So it had already been some time. So granulation tissue started to form, and it was healthy on the other part of the wound. So the flaps like up here. And because it was a triangle flap, there really was no way to suture it because that was starting to granulate. It was just kind of sticking up on its own. And so because the only other option to save that piece is you'd have to basically start over. You have to get rid of all that fresh margins, all of it. It just wasn't worth it. So I just did some lidocaine and cut it at a nice angle, and it just kept granulating in.
Yeah, she cut it as close to the base as she could, and then we cauterized it pretty much.
If
with
it
a
were
nitrate
fresh,
stick.
we could have sutured it and saved
Reattached
it,
it,
but
yeah.
it wasn't
Yeah.
fresh. So
It's just like crazy.
Yep.
It was horrible.
And so then the wound's healing on its own the rest of the way.
second intention.
Okay, I like it.
Okay.
Very cool.
My case is a cat that I briefly spoke about last week, or the week before, but it's a 3-year-old female spayed domestic short hair. She presented for vomiting and not eating for about a week. So we did some in-house blood work, and blood work came back, ALT, alk phos, globulins, borderline high, GGT borderline low, and then her total bilirubin was 8. So long story short, Dr. Jones suspected hepatic lipidosis. And then the owners were here for a very long time, and we discussed all of our options. It was like 5:30 at this point, and we were discussing hospitalizing the cat and placing an esophagostomy tube, referring, or euthanasia, because the cat had not been eating for a week and was just like vomiting nonstop. So after a lot of thought, they opted to take her home that night, and we sent her home with Mirataz, just because they'd just gotten married. They'd been through a lot health-wise on their own, and just like financially weren't at a place to pursue referral or hospitalization. And then the next morning they called stating that she vomited the entire night.
Yeah.
So we ended up euthanizing her. But we don't know the cause of the hepatic lipidosis, and it just kind of stinks that she was 3 years
Was
old.
she overweight?
A little bit, but not terribly. She was 12 pounds.
She might have been more before.
Yeah, I was going to say, usually the hepatic
true.
lipidosis is secondary to them just not eating, but
Yeah.
but then you're
And
like,
then
well, why
there's-
were you not
not eating? So
Yeah.
like, what are some of the primary causes of not eating in a cat?
Foreign body.
Foreign body. What else? I'm just
Kidney
doing this for
disease.
our listeners. Sure.
But I mean, her kidney values weren't that elevated.
Right.
No, her
Pancreatitis.
BUN was low, but
Pancreatitis.
her
Yep.
other ones
That'd
were
be
good.
top on my list.
Yep.
Yeah.
So
Or-
also just a reminder to bring your pet in as soon as you can when you notice them acting off. I know
Was her CBC normal?
relatively. Let's see. Her eosinophils, platelets, and PCT were low, and then her RDWs were high.
Okay. But not
the
a
rest of it's-
neutrophilia. She didn't have a neutrophilia.
Nope.
Or,
Foreign body. Maybe.
especially with the vomiting. I mean,
Yeah, that's the only thing.
Yeah.
but yeah, those
unfortunately,
are
financially,
really,
we
really hard cases to reverse because you have to stop
Yeah.
that feedback loop that's happening.
Usually
cat
the chance
metabolizes-
the feeding tube's required.
Yeah.
the chances.
I mean,
of
you
her
really
bouncing back
can't
were
fix
not
them without
high.
a feeding tube.
Right.
Yeah.
I mean, because they're metabolizing their fat stores and they're going to keep doing that until, and cats are just weird. They'll flip
Yeah.
a switch and stop eating.
Like they considered
And-
the feeding tube, but we were like, the chances of her bouncing back, like we can't guarantee that you're going to go through all of this and she's going to bounce back. So
Well, and you still would have needed to
Difficult.
do additional diagnostics
Oh,
to
yeah, for
determine
sure.
the primary underlying cause in order to know how to stop that
yeah.
and then address the hepatic lipidosis on top of it. Because Duckwall's right. You that's just a secondary,
It's gonna be a
typically
rabbit
a secondary
hole.
problem.
Yeah.
It's
But
gonna be a long road to recovery.
yeah,
Bummer.
those are hard.
Speaking
Hard
of cats,
cases.
they're really getting on my
3 years old.
nerves recently.
Cats are really getting on your nerves.
They just die
Yeah.
or they try
Yeah.
to die.
Yeah.
Like at the most random
Silent sufferers.
Yeah.
But they're not they don't have like some of them don't even have a problem. I look at them, they get stressed out.
This is true.
They go into respiratory distress and then they try to die.
Yeah.
Like, I feel like that's
we
been
did a
happening
cysto.
very often.
You've had quite a few.
We
of
just did a
those.
cysto on a 2-year-old, and he had a
Vagal response?
vagal event or whatever.
Oh my God, but like,
He bounced back. He was fine. But
Oh,
we had to
yeah,
get
he-
oxygen real quick.
yeah, I mean, I sprinted just
Oh,
with the
she
cat. I was
did.
like, oh my God.
Yeah.
Yeah.
But he
That's
was
scary when that
he,
happens.
he bounced back by the time I got to treatment. But
Yeah.
oh my God,
Yeah. They're finicky little things.
they
are.
just it's been happening so much recently. Like one of the other techs too has been dealing with that. I'm like, quit.
Cats.
Stop trying to die, dang it.
Oh,
Freaking
goodness.
cats. Love them and hate them.
They're too sensitive. All right.
Listener question. Can you consider a discussion topic on how clinics and hospitals handle suicide after it happens and how staff who have gotten help can return to work? We recently had a male assistant who had to take a week off due to needing to get help at a mental health facility. He reached out to me early on a Saturday morning saying how he was not okay and can I come get him? I'd been open with him about my previous struggles, and we had some conversations about mental health and what to do if he was thinking the worst. So glad that he did reach out. Luckily, I work at a great clinic who was understanding and gave him the time he needed. Ultimately, he decided to leave and move to be with family. But how can we ease the worries of other staff? I think people would be more willing to get help or take time off if they felt it wouldn't negatively impact their employment status. It sounds silly, but even having those days count against our time off would prevent some from getting help. At Alana J.
Good question.
That's a great
Mhm.
question.
Yeah. Absolutely.
Well, let's dissect this. How
I would say start with
do you-
prevention as much as possible.
Right.
So, preventing.
Making sure the work-life balance is there from the
Mhm.
start for everybody.
Mm-hmm.
And then adjusting according to individual needs based off review or like recaps you do with them, sit down meetings, things like that.
Open dialogue.
Yeah. Yeah.
If they're talking about, survivors of suicide, so bereavement, by suicide, basically, so like there's all these scenarios, that have happened in clinics where someone has taken their life inside a clinic and staff have found them or whatnot. You know what I'm saying? And so then I think she's asking, like, how do clinics handle these people coming back to work? Like, what do you do for these people when they come back to work? Well, first, let's say we're not qualified to answer this question.
We personally, none of us have dealt with it. I don't think.
And so I would say, we need to, I would tell you to use resources that are designed for that purpose.
Yeah.
So if you're struggling as a veterinarian and having trouble, and you're in a dark place, then there's it's called Vets and then the number 4 Vets. And you can reach out to them and they will have one-on-one conversations with you. There are other veterinarians that are trained in mental health and suicide prevention and things like that. So that's one resource. But then if you're talking about like surviving suicide, then there's like survivorsofsuicide.org that would also have information.
Yeah.
The National Action Alliance for Suicide Prevention. I mean, all those things are resources. So I would say having resources at your facilities, right? And then
Also having people. He's incredibly lucky to have
yeah.
her as a
to
coworker
call
/
and-
friend.
Yeah. That's
Make your clinic a
You
safe
don't know how
place.
much
And I was just listening. This is so bizarre, the timing of this, but I was just listening to, because everybody knows I coach basketball for at high school. And one of the things we have to do is every 2 years we have to take these high school sport classes. And one of the classes is on suicide prevention. And they say that in there, the statistics show that people talk about it before they ever do it. So when you hear somebody talking about it, hardly ever is it not talked about. Like there's something that they're talking about. So like warning signs, looking for warning signs and then getting people assistance, not trying to solve the problem yourself. If you're somebody that's a friend and somebody's talking to you about those things, is really important.
Yeah. Maybe having a professional come into the clinic and having just like a relaxed, like, hey, anyone need me? Or everyone doing okay type of thing. And because it's such a private thing too. It's like,
It's hard to talk about.
Oh,
and you just don't want to make, if someone's coming back to work, right, you don't want to make them feel different.
Right.
I'm sure it's such a fine line to walk of like, you want to show them that you care and you don't want to brush them off like they're fine, they're back. But you also don't want to just bring it up at the workplace all the time.
And
Right.
be overbearing about it.
Right. Yeah. You definitely need to like tread lightly, make sure it's like an appropriate time if it is during the workday, or reach out privately. And just kind of like, I think the biggest thing is people just want to know that people care and that they're there for them. Like
Well, and if you experience that, if you're part of that experience and someone does that and you're surviving that whole experience, you have an increased chance of having a negative mental health outlook.
Sure.
And so they talk about, intervening for you. You need to intervene as quickly as possible for yourself, when you're surviving those things. So, yeah,
Therapy's not a dirty word.
Yeah.
No, I mean,
I don't think there's much
unbiased
negative connotation around it anymore, but
Oh gosh,
I don't think so either.
Yeah.
which is awesome because I feel like it used to be like, oh, you're in therapy.
I will say I don't think it's talked enough about in school though, like vet school, tech school. I just, they offer, at least for me, they had, I don't know, the school like counselor, come in and do her talks or whatever and say you can sign up here, and that was kind of it. I feel like because there's statistics on the field and like the gravity in which it happens, like why not dedicate more time to that open discussion? And like, I mean, you never know, people who are like quiet like a cat, silently suffering, or they're like, oh wow, I maybe do have these like type of tendencies towards not necessarily suicide, but like depression, anxiety. Like some people don't even recognize it unless somebody else comes to them with it, or you get so drowned out in your own thoughts, you're in a dark hole that you just have to get a lifeline sometimes.
Well, and I think that those things that represent the mental health issues are things that people think people are just being uncooperative, or they're being, I don't know, like a poor team player, or, they're just negative Nelly. They're never happy. They're always, and it's
Not
like
that they're battling
versus, somebody can be that way, but it could also mean something completely different.
Yeah.
And that's how that
struggling,
struggle is being displayed in their work environment.
Yeah.
And so,
yeah.
No, I agree with you. I think the schools don't do enough probably to educate on it, like what to look for, how to know that you're going down that hole. What do you do if you start to go down that hole? Like, I think that would be, now maybe they're changing that. I mean,
sure, I'm
even
just
since you've been in
online,
school,
but I've not been educated a lick of that.
Yeah.
And I think I would have learned about it by now.
That's what I said earlier. I want to educate people more on it because you don't know where you're getting into until you're in it.
I know.
They just don't prepare you.
It's
like
really
I said, I don't want to
disappointing.
deter people from being in the field, but you need to be prepared.
Right.
And try to have a handle on it.
Exposed to end of life so often and so much that, I mean, just it's so interesting speaking to people outside the field, and they'll say like, yeah, I can't, I couldn't do what you do, and
I don't know
like
how you do this all the time,
right? But when I like even share, I've said I've been counseling before, and when I speak on like heavy days or a lot of euthanasias back to back, it's crazy that such an unbiased a person is like, you deal with this way more than like whatever small percentage in the human population. So it's natural and normal to have, I don't want to say like just having struggle with it, to have struggle with that alone, let alone the fact that we're trying to do all these other things. Right. So it's okay that this is heavy and hard. Like, I feel like that's the other problem is you're expected to do all these things, whether you're out of school, whether you've been out for however long and have all the answers or, meet this expectation. And it's just at some point you have to, I don't know. At some point, you just have to acknowledge that either you're doing the best you can, or, you know what, this has been a really hard week. This has been a really hard time. I need to step away for X days, X hours, say no to this, say no to that, because in the long run, it's just you have to stand up for yourself.
Yeah.
So no one should come out into the field thinking it's never going to be hard. Sorry.
Yeah.
Like, it's
Yeah.
just not.
I know people like when they ask about my job, they're like, how do you do that? It's like we say like, oh, well, you just get numb to it. But I mean, you only get numb to a certain degree.
Yeah, you're still
like
human.
you can't, yeah. You're going to have feelings.
And if you actually care
feelings are
about your
good.
job, you're not going to just never feel
Well,
it.
I think the problem for us is that you're a cross between a funeral director, a doctor, a therapist. Like you're like a cross between all of these things, right? Because you're trying to meet all the needs of the client.
Yeah.
You know, and so you get thrown into all the different roles.
Yep.
And so then it's hard, you know, then it's hard to separate all of that.
Yeah.
You know, in your head. And so it can be very challenging.
And depending on the type of personality you have too, like I'm a hypersensitive person, whether it's like when it comes to sounds, emotions, like that type of, so I may not think about things when they're happening that much, but I feel it. And it's just like one of those things, knowing your cues, knowing your triggers on how you're like, oh, I'm feeling this certain way. I know that this can lead to I don't know.
Yeah.
Anyway.
Yeah.
But
I think something to keep in mind, which Mom, I know you mentioned in the Instagram stories yesterday, I believe, or the day before, is especially for vet students, is that being vet techs, is that being a veterinarian or a vet tech is just one aspect of your life.
yes.
So not letting it consume you whole as a person. I think, you know, we got a lot of comments and DMs about how, you know, schools really harp on grades, which can, you know, lead to that kind of mindset, which can then lead to, you know, some of these thoughts. And I think that it's important to just keep that in mind, and also keep in mind that most of the time, veterinary clinics, when you get out of school and not looking at your grades whatsoever. So
Yeah,
that is true.
something to keep in mind. They're looking through your experience.
We've hired 10 veterinarians. I haven't asked a single one of them what their grades were.
What was your GPA?
Because you graduated. I assume you know what you're doing.
Yep.
It's totally different than...
Well, and it's so hard because getting into school is such a competitive, like, you got to be at the top of your class. You have to have the best grades. And to let that go, like let that thought process go, is so difficult because you don't know that you got there. You just
I don't know if
celebrate it.
internships are different based off grades. I don't know about that. But I mean, like, just general hiring, we don't
Right.
care.
I think interns
Do or not? Or
well,
is
I
it
think
just
it depends
mostly
on the
matching
program and like what you're
Yeah.
going into and stuff too.
Yeah.
Like, but I mean, there's got to be a criteria for that type of stuff,
Right.
but they still get interviews and stuff like that. Like, I don't think they're like, we're not going to accept someone who got a C, you know,
Right.
that's not the case. But
Right.
yeah, I think that's another huge point is you are more than a veterinarian or a vet tech or an assistant. Like, you are your own person who has all of this outside of the environment.
You're a wife, you're a mom, you're a daughter.
Yeah, like just all the things. Like you matter. You mean something to somebody.
Mm-hmm.
Yeah.
So
It is one ingredient.
Yeah.
That's it. So, and then she mentions also not having, but even having those days count against their time off would prevent some of.
I think that's where you need
Yeah.
to make sure like you feel that you have a safe place at work and you can talk to your leadership team or whatever you have, just to be like, hey, I am not okay. And then that your team should understand. And if they don't, that's really sad.
I'm like,
Yeah.
oh, I have to use my PTO for a mental health break, you know?
Yeah.
Feeling
I think
comfortable that they
that-
can take the mental health break without having to worry about.
Yeah, I
Missing
think
work.
that it's just really hard if you're running a business and
That's true.
it's just really hard to be like, yeah, take a mental health day, whatever you want it, and I'll pay you for it. Like, it's really hard. And I'm not trying to be callous or like
it's
insensitive,
It's a
you know,
gray
but it's
area.
a really gray area. Now, if somebody came and was in this situation, well, yes, you would be like, yes, take 3 days. Don't worry about this, you know, kind of a thing, which is what we've done in the past. But it wouldn't be a standard protocol. Do you know what I'm saying? Like, it
sure.
would be a case by case kind of
Yeah.
basis or whatever.
Well, if you're at an intuitive, like, safe clinic, they're going to pick up on, like, hey, are you doing okay? Like,
Yeah.
you notice you missed this or, you know, I mean,
Yeah.
and then you can then use that to say, okay, let's like maybe arrange where this mental health day, we also can figure out like a resource for you.
Well, yeah, because if somebody's doing that, right, mental health day this is being obnoxious, but weekly, you're like, all right, something needs to change because that's not good.
Right.
You can't live that way.
No.
You know? And so there's, you know, or even monthly for that matter, like, you know, that's 12 days a year. That's a lot of time that you don't feel okay.
Yeah.
Because there's probably more days than just that. And so, you know, what can we do so that you don't have to have those days? You know, like we're really lucky because we have counselors that are available, you know, for employees, you know, but, you know, what can we do? How can we set this up? Do we need to move you to a different seat? You know, blah, blah, blah. I mean, like there are definitely avenues that can be explored for sure. Absolutely.
Yeah.
Okay.
And if ultimately leaving the field is what's best for you, don't feel ashamed in that. Like you're doing what's best for you. That's that in and of itself is applaudable. Like that's what you should do.
Yeah, absolutely.
Self-care is important.
Yep. Okay. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thank you.